Hello? Hey, can you see me? Oh, no.
Yes, we can see you. Thank you, Amira, for joining us.
Okay, great. Hey, so is this now?
Yes, we're on. So we have 3 people where you can see the panelists right now. We were just giving everyone a few minutes to get on. I think maybe in a minute or 2 we'll start and take some time.
And then is Dr.
Sharif?
Safran going to be,
He's here.
is he, okay, is he going to go first and then I go second, or how are we doing this?
Yes, you're going to go second. I had talked to someone from your office and they said to join at 6:20.
6:20?
Yeah.
Okay, no, that's fine. I knew that. I just wanted to hear what he had to say. That's why I stayed on.
I'm not going to say anything that you don't know, Amir.
Well, I'm just getting out of another interview and I'm trying to figure out how to get driving. So I'll stay off video here.
All right.
Guys, stay safe.
Good seeing you guys. Yeah, absolutely.
All right, so we're going to get started, everyone. We have people in our room. Thank you so much for joining us. Please be patient. This is the first time we're actually doing a webinar this way. We tried to do a dry run this morning to make sure everything was taking place okay. But we're really excited to do this webinar with 2 experts in the field. And those are, of course, Dr. Sharif Zafran and Dr. Umair Shah. So what is our goal in this webinar? It's really to provide everyone with updates on what's going on in light of COVID-19 here in Texas, and in particular here in Harris County. We want you all and everybody in our community to have accurate and reliable information on how to deal with this pandemic, especially in light of our families, our neighbors, our communities being affected or having the potential to be affected. So we will ask some questions. So the way we're going to do this is we will first talk to Sharif, Dr. Sharif Zafran, ask him a few questions. Then we'll talk to Dr. Umair Shah, and then we'll open it up and ask all of you to give us your questions. Now, the way we're going to do this, if you look at the Zoom webinar, you'll see a little Q&A on the bottom. And if you could please write your questions in there, and we'll start taking those and filtering those and making sure that our experts are here and can answer that. So before we get started on the webinar though, we did want to remind all of you to please respond to the census. So right now we are in the first week of April. April 1st was actually Census Day. And we are making a huge push to make sure that people are taking part, that we're being counted. And it's so important that we get counted because that's how we get the resources we need to come to our communities. And look, we're in a pandemic right now. We're going to need those resources. So we want to make sure that we get that. We only get that if we have the numbers to prove it. And how do we get those numbers? It's if all of our folks do respond to the census. You go to my2020census.gov. Very simple. You can fill it in online. You just have to visit that website. You don't need anything else other than that. 10 minutes, under 9 questions. And it's so important for everyone. So we do hope you will go ahead and complete the census. So we'll start with our introductions. I'm going to talk a little bit about Dr. Sharif Zafran. I count him as one of my personal friends and mentors as well. He's also done a lot of work in the medical industry, which is why we've invited him. He's actually the president of the Texas Medical Board. He's a board certified anesthesiologist, vice chair of the Clinical Governance Board for U.S. Anesthesia Partners in the greater Houston area, and very politically involved, serving on the U.S. Department of Health and Human Services Pain Management Task Force. He's a delegate for the Texas Medical Association. He's a member of the Committee on Government Affairs. he knows his stuff. And being the president of the Texas Medical Board, he has a direct line to what's going on at the state level. So we're very lucky to have him here. What we're going to do right now is just, I think we'll start just with the questions. So Sharif, just tell us a little bit about what is happening right now on the state level. And I think even before that, if you could just give us a general kind of layout of what COVID-19 is and why it's become such a huge threat to us in such a short period of time. And then how is Texas responding to this threat? And thank
First of all, Nabila, thank you, and thank you to Emgage for inviting me and Omer, who we're obviously good friends also, to come and have this conversation with everybody. It's an important time. It's obviously one of these multi-generational type of events. So we're all kind of in uncharted territory from a healthcare standpoint, from an economic standpoint. It's obviously impacting every single individual, and it's one of those things where we have to come together as a community, as a nation, and how we tackle this. So coronavirus or COVID-19, coronavirus, by the way, is a family of viruses. So this is one type of coronavirus. But COVID-19 is a type of virus that we believe started in China. It obviously has started spreading very fast. It's unique and a concerning type of virus because not only is it more virulent, which means that it has a higher mortality rate compared to viruses like the flu, for example, and its rate of transmission is also much higher than the flu. The most concerning thing about it, though, is its ability to transmit from one individual to another while there are no symptoms present. So typically speaking, if you look at something like the flu, if you're not having any symptoms, if you're not having the runny nose, fever, all that kind of stuff going on, typically you're not at a stage where you're going to be able to infect somebody else. With the COVID-19 virus, you can have the virus but have no symptoms whatsoever, and you'd still be able to transmit the virus to somebody else. And that's the big concerning thing about it, is that not only is it more virulent, not only is it has the ability to transmit to a larger number of folks, but it can do so while they're asymptomatic. It does it by aerosolization. In other words, you have droplets in the air that can transmit to somebody else. But also if you cough and those droplets fall on a surface, it has the ability to live on that surface for many, many hours so that somebody else can come later on, put their hand on that surface, put their hand on their mouth, and easily infect themselves that way. So it's a mechanism of transmission, and its infectability is something that creates a lot of concern. And as you can see from back in December, when we heard of the first cases in China, in Wuhan, that several months later you have something that has become a global presence and has started to climb fairly rapidly. The concern again is because you can have a very large number of folks infected, and you're talking about the potential of somewhere between 1% and 4% mortality. Again, we don't know what the actual data is because we don't know how many people are positive. So it's difficult to understand how many people are dead versus how many people are actually infected. But we're guessing somewhere between 1% and 4%. So if you look at the total number of folks in the United States who could potentially become infected and translate that into that mortality, you're looking at potentially a very large number of people being affected by it unless something drastic is done.
Right. So if we look at what the number of coronavirus cases we have right now in Texas, what would you put that on, like as of today? And then also, how many deaths do we have right now? What is the number?
So if you look at Texas specifically, as of half an hour ago, you're looking at 4,669 positive known cases, and you're looking at 70 deaths. I can tell you more specifically, the majority of those are probably, well, actually they're in Dallas. We've got 731 cases in Dallas. 15 of those are deaths. In Harris County, you have 847 positive cases. So more cases in Harris County, but less deaths. You have about 6. There's a little bit of a lag time between positive cases and deaths. Typically speaking, usually about 2 to 3 weeks. I can tell you that about a week and a half ago, the total number of deaths in Texas was 3. So you can see how quickly it's escalated from 3 to 70 over a period of a week and a half. And you'd expect that number to start escalating fairly quickly. It's a logarithmic curve. And so those of you who have seen the curve, it kind of goes up in a linear fashion, and then you get to the point where it goes up logarithmically. So you're going to get to a certain point where those numbers are going to start accelerating. And you can see that fairly classically in the total number of deaths in the United States, where it was 10 deaths, 20 deaths, 30 deaths. All of a sudden now you're having 1,000 deaths a day. So that's part of what we get very nervous about, is the number of positives versus the number of deaths. They start to escalate fairly quickly.
Sure. Sharif, we're getting a few folks are saying that the voice is a little low, but I think, okay, it's getting better. Good. Okay, so, I was talking to someone this morning, and what we were talking about was the rate of spread, right? And you spoke a little bit about that spike that happened. I think what a lot of folks are really getting nervous about is what is happening here in Texas in terms of our rate of spread. Are we going to see a situation like New York? Are we going to become that next hub? And when do you think we'll get to our peak, as it were? Keeping in mind that you said there's a lag effect.
Yeah. So University of Texas Public Health has modeled a lot of this out. The expectation as to when our peak is going to be is probably toward the end of April. We actually have several models around capacity of ICU beds, which is a little bit past what the peak is. Remember, I told you there's about a 2 to 3 week lag between positive cases and when you actually start seeing people in the intensive care unit. That percent of folks who are positive who actually end up becoming very sick. That period of time is probably going to be early to mid-May. So you're looking at a peak of number of cases around the end of April, a peak of very sick people probably around the first to second week of May. How aggressive we started becoming as far as the sheltering in place and the social distancing really is what is relating to how the peak ends up becoming and how spread out we can make it. So the fact that we actually started a little bit earlier in some cities, now it hasn't been uniform. Harris County was a little bit different than Dallas. That was a different than San Antonio and Austin and so forth. Really affects when that peak ends up being. What I'll tell you is that in New York and in New Orleans, where you're seeing, some concerns out there, if you really kind of go back to mid-February and look at the time period when you had Mardi Gras, and when you had a large congregation of folks there, you're starting to see the effect of that now, where not only did you have the positive number of cases a couple of weeks ago, but the number of sick people actually happening right now. And you can actually track it fairly consistently as to when that was. And that's why you're having a large number of folks in Louisiana. I say that because if you saw about a day or so ago, we mandated, or the state mandated, that folks coming from Louisiana end up being quarantined here in Texas for a couple of weeks. The concern is the spread from areas that have a large number of folks coming into our area, where we've been really trying to ramp it down with the social distancing and the sheltering in place to try to, minimize the spread, or at least minimize the acceleration of the spread that's out there. What we've done as far as starting the sheltering in place early on in many of our cities, I think is going to help blunt that effect. Again, the models out there show that what could have happened versus what we think is going to happen really has been impacted by the sheltering in place mechanisms that we have.
And you mentioned New Orleans. So is that going to be the next big New York? Is that what the expectation is?
I think there's a lot of concerns that it will be, Nabila. I mean, if you look at the numbers that are spiking, and again, it's it's not interesting. It's not good. If you look at the number of positive cases, and you see that the number of deaths hold fairly constant, and about 2 weeks later, you see that number of deaths start to climb fairly quickly, and you kind of see that in New York right now. That kind of becomes also associated with the capacity issues that we have with number of ventilators, number of ICU beds, and all that kind of stuff starts catching up. That's why we're starting to prepare in Texas now for what we think is going to be a big issue 2-3 weeks from now. New Orleans is starting to get there right now, where they're starting to see not just a number of positive cases, but the translation into a lot of those sicker patients who are going to need ICU beds, and unfortunately are going to start getting into that number of mortality rate that we're going to start seeing fairly quickly. So yes, there and in Detroit and other places, you're going to start seeing that.
So, your advice to our community right now, to everyone that's listening, what would that be? What should we be doing kind of right now in this particular moment?
The biggest problem that we see is that because the threat is not visible, it's sometimes much harder to convince folks that this is a real threat. It's a lot easier today than it was a couple of weeks ago because people see what's happening in New York, and they see that the concerns that were voiced are starting to actually pan out right now. The social distancing works. It's really important that we pay attention to the small things, like, again, maintaining that distance, but also the hand washing. And I would even go one step further and not hand washing alone, but also face washing. That is very important. Remember that soap works just as well as hand sanitizers. So we talked about hand sanitizers being important, but I know a lot of folks said that they're in short supply. Washing your hands with soap is critically important. Coronavirus is a virus that is held together by lipids, which is fat, and soap is very good at disintegrating fat and breaking it down. So washing your hands with soap, washing your face with soap, doing it often, encouraging your kids to do so. One of the other things that I also tell folks to do is take your shoes off outside. You're walking out there, the surface of the ground can easily have viral particles on there. You don't want those shoes coming into the house and spreading that all inside the house also. So little things like that go a fairly long way in helping minimize that spread. I also tell folks, think about your mail. When you bring your mail in, you don't know how many people handle that mail. And again, what we do in our household is, unfortunately, we end up just spraying our mail with Lysol before we actually bring it inside the house and then washing our hands. Same thing with groceries. Just think of things like that where you just got to be very vigilant about who's touched it, where's it been, and trying to minimize the ability of that kind of stuff coming into your household.
And, what we're excited about right now is Ramadan. It's a big, obviously, event in our community. It's going to be starting in a few weeks. This is probably the biggest event in the Muslim community. And then, of course, we have our Eid prayers. We look forward to it. We know right now that the masjids have pretty much shut down. And you talked already a little bit about the timeline, but is there any hope for Ramadan? Are we going to have our Taraweeh prayers? Are we going to have our iftars? What is this year's Ramadan going to look like?
So from the health policy side of things, I would very strongly encourage, as our dean tells us, is that when there is a plague, to stay away and to maintain that distance. So even from a religious viewpoint, we are actually commanded to make sure that we actually stay away from congregating. So this is, I know there's a lot of concerns about prayer being a mandate on us, but there's an even bigger mandate when there's a plague to actually stay away from congregating. Again, I'm not a religious scholar, but I do know that Ramadan is a time of reflection, and it's a time sometime of actually being alone and reflecting. And mashallah, this may be a time where we actually have that opportunity to concentrate on the individual time of reflection and prayer, and to actually pray for not only our community, but for our wider community and our global community to get us out of this plague. It's very, very hard nabila economically on a lot of people. You guys saw the unemployment numbers this week, 6.6 million on top of 3.3 million last week. If I would ask all of us, especially at the time of Ramadan, is to think of all of those out there who may have lost their jobs, who may be struggling financially, and to really focus all our efforts in making sure that we help our community make its way through this. Isolation is not an easy thing for our kids. I can tell you even for my own kids, staying at home and learning from home is not easy. But even for us as adults, stress and depression and all of that is going to be an even bigger issue that we have to all tackle. And, luckily, alhamdulillah, we have things like FaceTime and Zoom and all these where even though we're socially isolated in a physical standpoint, we can at least feel connected from that standpoint. And so on the religious community side, I would encourage at least, halaqat to be done in a fashion like what we're doing here, where we can at least be together, but not physically there. so we can at least feel the spirit of Ramadan, even though we may not be physically together. But to come back to your point, I would discourage folks from gathering at masajid, especially as we are still in the middle of this pandemic. We talked about the peak being in the next 2 to 3 weeks, which is going to be right in the middle of when Ramadan is going to be going on. I would encourage everybody to do tarawih at home. Just, being out in the community and actually congregating. You guys have seen a lot of examples where churches have done so, and unfortunately that has translated into epicenters of transmission of the virus. You're bringing that back home, you're transmitting it to your kids. It's just, maybe to the grandparents who are very susceptible to this. I would just really discourage folks from doing that.
Right, right. So it should be a really interesting Ramadan for all of us. I know that a lot of us are living on Zoom right now, and I think that's where we'll be getting a lot of our information and a lot of our socialization. Are there any other resources that you can share with us that we should send folks to find out more about the coronavirus, get the most up-to-date information about the coronavirus?
Yeah, so, and Omer is probably going to talk a little bit more in a second about Harris County and the resources that we have here. The CDC has a link to the coronavirus that talks about what the CDC requirements are, which are, again, ever changing, depending on what our circumstances are. At the state level, we have that too. From the medical board standpoint, and as we are licensees of physicians and physician assistants and respiratory therapists and several others, we have a link there, especially around making sure that we ramp up our workforce to allow for more physicians to be able to practice, getting more licensees into the state, getting retirees to be reactivated to allow them to also help practice in this kind of environment. We've loosened our rules around telemedicine so that folks who need to go to the doctor don't have to physically go there. They can do it through other means and still get their prescriptions for their medications so that they can maintain the ability to actually get their health care taken care of. I know that statewide, if you have an issue and you need to talk to somebody about concerns with symptoms or anything like that, call 211. They will direct you to an area where you can get treatment. Whether you have insurance or not, there are resources out there for those who do not have insurance. The stimulus package that Congress passed allows for people to get treated and tested, even if you don't have the financial ability to do so. Financial resources should not be a reason for you not to get appropriate health care in this environment.
So what you're saying is to call 211 if you believe you need some kind of treatment. Is that just for the coronavirus, or is that for any kind of health care at this point?
It's primarily for the coronavirus, but it will help direct you to clinics that will be able to help take care of you if you don't have the resources to be able to do so. Of course, if you have a primary care doctor that you're able to connect with, go through that first. But if you don't, or if you're not able to reach your typical physician and you need to get help, call 211 so they can direct you. If you fit the cascade of symptoms, they will send you to a drive-through area where you can get tested if need be. It's just a resource that if you need, they'll be able to help direct you right away.
And just a little bit more about kind of the response that's coming from our state capital. Are they, I was reading something just a little bit earlier that, we're not under a state stay-at-home shelter order, correct? Or county by county?
Yeah, so we are under a maintain your distance statewide order, but we are under a shelter-in-place order by specific counties or cities. And the reason the governor is giving to this is that we have over 250 counties. Over 200 counties don't have a single case. So the concern is making it statewide when there may be the specific epicenters where you really need to focus on. I know there's different theories around that, whether just because you don't have any cases there, that doesn't mean that there's not asymptomatic virus that potentially could spread quickly. But that's the viewpoint that we have right now. We're focusing on social distancing. We're focusing on making sure that only essential businesses are open. We're also making sure that we maintain and try to maximize the availability of our protective personal equipment resources. That's why we've canceled all elective surgeries. That's why we're increasing the use of telemedicine so that there's no congregation of patients in doctors' offices. All the things that we can think of to try to, again, avoid people congregating in any kind of place.
All right, great. And everyone that's online right now, please continue to ask questions in the Q&A. We are looking at them. We'll continue to ask them. But thank you so much, Sharif, for sharing your info with us. I hope you'll stay on. We're going to introduce Umair at this time. So very happy to introduce Dr. Umair Shah. He is the Executive Director and the Local Health Authority for Harris County Public Health. He is the executive director for the nation's third largest county, which is of course Harris County, and he is on the ground. And we know how busy you are, Umair, so we appreciate you joining us. He's been had a very successful career as a emergency department physician, and is on a number of boards. I'm not going to go through them; there are too many here. But he's known for his work in population health, equity, innovation, and engagement. Welcome, Umair. Thank you for joining us. Umair, can we get you on video so that we can ask you a few questions? If you could give us the latest, hi Umair.
Hey, sorry about that. Yeah,
No
a few technical issues, as you can see. I'm doing my best to try to make sure I get everything all squared away. As Sharif was talking, I was actually driving, so I have to admit that I was consuming everything he said, but obviously I was able to rush over somewhere where I'm now safely in one spot. So thank you for having me.
Wonderful. No, we're so happy you can join us. And Sharif, please feel free to chime in if there's something that you want us to also think that's important for us to hear. So give us the latest update, Umair, on what's happening with COVID-19 right here in Harris County.
Well, let me just start by saying that I think Sharif has really covered a lot, and I know there are a lot of questions, so I want to keep my comments very brief. And I will say that our team has been tested. Our team has been working very hard. I completely agree with what was mentioned earlier about the incredible heroes that we've seen in our healthcare community, because they are absolutely heroes. I'm one of them, not a hero necessarily, but a healthcare provider. And my wife, as you know, is a dentist, so she's also a healthcare provider. And along with Sharif and others, I absolutely want to start by saying thank you to all of our first responders and our healthcare providers, because they're just amazing what they have given of themselves right now. And obviously you're seeing that play out not just locally, but across the country. I also want to recognize the incredible work that has been done with public health across the country. And I think you've seen some of this, where at the end of the day, I really believe that the invisible workforce, the offensive line of the football team, is truly our public health epidemiologists, our logisticians, our clinicians, our folks that are doing all sorts of coordination across the board. And I think it's times like this when we recognize the absolute importance of public health and prevention, when we're oftentimes in the face of calamity. But I do think we have to really be thinking about investing in public health as a system, which I'm hopeful that when we get past this, and inshallah we will get past this soon, and hopefully sooner than later, that we can have a serious conversation in this country about the fact that we are not investing in prevention and public health in the way that we need to. And that is something that I'm committed to. And obviously I've been preaching for several years, but I want to make sure that we do remember that that offensive line that's absolutely critical to the work that happens in our system. I do want to say that, as Sharif had mentioned, that we have had a number of cases across our community, and that number of cases really gets us to the point where we are really faced with some real challenges. One is that we have an increase in the number of cases. We also have the testing constraints, which has made it very difficult for us to have a good true denominator of how many folks really are out there who have COVID-19. And we initially were really watching what was happening in China, and we were saying it was a matter of if. And then when we started to see that it was happening either in the US or more locally, we were saying it was a matter of when. And then when it started happening in our community, we really started to say it's a matter of now. And I think that's the biggest challenge right now we have, is to really do everything we can to protect our communities. And I think that's what we're committed to, public health and healthcare alike. Those social distancing policies that Sharif mentioned are really so important. I mean, we can say so much in healthcare and government and policymakers, elected officials, public health, everyone together. But unless we are, as community members, doing everything we can as our part, this is not an extended spring break. This is not just a vacation. This is really lives matter. And if we see an incredible surge in our healthcare system, because in those communities like New York and elsewhere where it's happened very quickly. If it happens, we just simply will not be able to handle that surge, and people will unnecessarily die. And I think I don't mean to make it grim, but it's the reality, and that we have to really flatten the curve, and we have an opportunity as community members to do everything we can to ensure that we're doing our part to stay apart from each other, stay emotionally connected, but physically apart, and do everything we can to really do the hand hygiene and everything that Sharif had mentioned, as well as the protective steps that as you come home, so you're not exposing your family members or your community members, that we have to really stay apart. We have to take this seriously. And if we do not take it seriously, unfortunately, we're going to see what's happened in other parts of the world. And we do not want to have that happen locally. So with that, let me, Nabila, just kind of pause there. I've got a lot more I could talk about, but maybe it's better if I just stop there and just let you give some questions and or from the viewers for what you might want to really have me focus on.
Right, and we're getting a lot of questions, and I'll start asking you some of them. So, could you give us more information about masks? So apparently, there's just a lot of different info coming out. Should people look for specific types of masks? Should one wear a mask when they go outside, even if they are not a healthcare worker?
Yeah, that's an ongoing, actually rapidly evolving piece of this. And as you've heard over the last 48 hours, the CDC is reevaluating the recommendations on masks. Initially, the recommendation was that surgical masks, or those masks that a lot of people you see wearing outside in the community, that those are really to prevent, as Sharif said, droplets from going out to someone else. And we want to protect our healthcare workers, and we want to do everything we can to have those N95 masks that are really available for our healthcare workers, because we've had a supply chain constraint on the number of masks that are available in the healthcare system. So we want our providers, our EMS, our healthcare providers to be able to have those N95 masks that really protect them from others. Now, what the guidance that's evolving is that both from our global partners and other, the CDC, if you will, of other countries, are really asking the question that masks may be helpful in the U.S. response, especially when we don't have enough tests, especially we don't have a vaccine, especially since we don't have antivirals. And so really what we're faced with is, there you go. I lost the image for a second. What we're faced with is really this evolving guidance. And so right now what we're saying to people is that the recommendations have not changed, but really the most important thing is that if there is a way for you to cover your mouth or nose as you're going out, whether it's a handkerchief or whether it's something that kind of covers, especially if you're emitting any of those droplets out, that we would really ask people to consider that, but not to be so anxious and hyped up that they can't get their hands on masks, that there are other ways to really be able to, whether it's a scarf or something else, to be able to block the ability for you to transmit to others. I think that's really the evolving way this is going to go. And I actually believe that soon you may see some evolution of those recommendations by the Centers for Disease Control and Prevention, and obviously elsewhere. So I just want to point out that let's not just be focused on an mask mask, but really the ability to prevent some of those droplets from being emitted to others.
Okay, great. Yeah, and we're getting a lot of questions about those masks. What is the difference between the county's stay-at-home order and a shelter-in-place order? So what does stay-at-home really mean?
Yeah, we really, Nabila, this is a great question. We actually, and I have to give so much credit to County Judge Lina Hidalgo and her team and our Office of Emergency Management, Homeland Security, and all of our other partners at the county and elsewhere. And certainly along with Dr. David Purse, the Health Authority of the City of Houston, he and I have been connected on sometimes 15, 20 times a day and the mayor of Houston, obviously Sylvester Turner, the leadership that's being provided at that elected official level as well as elsewhere has been very key to this locally. And what I want to say is this, that we felt that the naming of what we were saying to our community was really critical. When you say shelter in place in Houston or Southeast Texas, it has specific meaning for hurricanes. It has specific meaning for active shooter events that we've seen. It has specific meaning for chemical events, like remember the ITC fire, we had the black plume over Houston, Harris County. And so we did not want that to be what we were giving the depiction to our community. This was saying safe at home, safe at home, work, safely, work from home, do the things that you can do. What we say is live, learn, work, worship, and play at home, that you can do whatever you can to minimize your interactions outside of the house. Shelter in place really connotates do not leave the house. That's not what we were saying. We're saying that we recognize in essential businesses or essential activities like going to a grocery store, that these are activities we absolutely need to let and ensure that our community can do. But at the same time, we want to limit the amount of interaction that's outside. And that's why these safe and home orders are really very much what we were trying to convey to our community.
Great. Okay, so here's another question. Do microaerolized droplets have a longer range than 6 feet? Does that mean we should expand our social distancing criteria?
Yeah, that's a great question. I would say no. I mean, 6 feet is really what we have recommended. Obviously, the most important thing is, look, somebody is in front of you coughing. Somebody is in front of you with symptoms. Somebody is in front of you that's doing something, sneezing, coughing, et cetera, in front of you. Please do everything you can to separate yourself from that individual. Flip it around. If you are coughing, you are sneezing, you are doing those things, do not go and infect even in your family others or those at a mosque or masjid or elsewhere. We want you also to be protecting others out there, right? So that's the key message. It's a bi-directional communication. What we're trying to say is, look, try to stay away from each other. That 6 foot distance is a good rule. If you can go 10 feet, great, but let's not overhype this. 6 feet is what we're talking about. And really it's about not just the distance, it's the type of interaction and the length of interaction that also come into play.
One thing I would just add to that, and we kind of deal with this quite a bit actually in the operating room, but it actually has relevance outside too. If somebody were to sneeze or cough and they're positive for the coronavirus, the area where that place is potentially going to be infective can linger there for up to about maybe 6 minutes. So, the idea of that social distance, it also means to be careful about proximity, but also the amount of time that you're close to somebody. That's kind of one of the factors that we look at is not only, that distance, but how long you're actually close to that person who might have been infected. So if somebody were to cough and they're positive and they kept on walking, that area that they're at could still be aerosolized for a certain period of time before it actually drops down to the surface. So again, when we talk about not lingering around, not walking, just be mobile, try to not be in an area of where people may have been lingering around, coughing, sneezing, wherever that might be, just using some common sense. But to Mayor's point earlier about the mask, that just kind of helps as one added layer of protection for aerosolized stuff that may be in the air to actually kind of hit your face and expose you. It's not going to be 100% foolproof, and Amir and I know that because the really foolproof masks are very, very hard to get. Those are the N95 masks, and we're really trying to preserve those for the healthcare workers who are at the hospital and potentially being exposed to positive cases on a regular basis. So again, it's about being prudent and understanding that the surfaces may have it, but in the air, it's not going to be there for a long period of time. But be conscious. If somebody just sneezes there, even if they walk away, don't walk right through there either. Just be conscious of that.
That's right. And the other thing, Sharif, and I think you brought up a really good point earlier, which also comes in here, which is what we're saying is wash your hands, right? And if you're touching surfaces, wash your hands frequently, and that you don't touch your face. You don't touch your nose and your mouth and things that we oftentimes don't even remember we do in the middle of flu season. But this is a time where we really need to be thinking about all those habits all those behavior changes that we often, really honestly, I'll give a lot of credit to our moms, right? That our moms have taught us, but we just haven't listened. This is a time to really listen.
Here's another question. How long can someone who is asymptomatic carrier, who is an asymptomatic carrier, continue to be a risk to others around them?
Yeah, that's a really good question. I'll tell you, and Sharif, certainly feel free to jump in. But the vast majority of people really are asymptomatic. But we are finding that there is a good portion of the people who are asymptomatic, or they are with mild symptoms, that still have the ability to potentially infect others, right, or expose others. So what we're really saying is, look, that what we have to do is really, at the end of the day, we have to take a mindset that everyone is infectious and potentially, but I would actually go one further, which is that all of us just assume that in many sense that you're already positive in some sense, right? You already have it. So what are you going to do if you're positive? You're going to stay away from others. You're going to try not to expose others. You're going to do all the hand hygiene. You're going to do everything you can to take vitamins and sleep more and make sure you eat well and all those things. So if you take that kind of an approach, I think it's incumbent then you are going to also invariably come across the fact that you are going to protect yourself, the loved ones around you, and ultimately your community.
Yeah, just to add to Amir, and I just want you guys to think about this. Just because I'm immune to the virus doesn't mean that I can't be a carrier of the virus on my hand, on my body, or anything like that. So I go around, it's not affecting me directly right now, and I'm touching something, and somebody else comes and touches it, you could potentially pick it up that way. The other thing is, number one, most asymptomatic folks don't know that they're positive to the virus. In fact, there's estimates out there that over 20% of the population may be positive, and they have no idea about it. So we've got to act as if we are always positive. That's kind of the mindset that we're kind of encouraging everybody to think through, is assume you're positive and act that way in how you encounter others and how you deal with others and how you also control yourself as far as hand washing and everything else, not just for your own self, but to not transmit to others either.
So
well said. Yeah.
Another question then. So and I think this may answer it. So if you're kind of self-isolating, staying at home, and you have other family members that are self-isolating and staying at home, so someone's asking, can we visit our family members that are also sheltering at home? Is that wise or no?
So let me take a crack at that, and certainly Sharif, jump in. What I would say is, look, what we're trying to say is if you're within the same household. Now, it's a little different for Sharif and I because we are going back and forth from other external environments to our home. And in fact, today I was on another segment with Dr. Person. He had made the recommendation, when you come back, you may want to consider staying away from some of your family, even in the same household, if you've been out coming back in, because you don't want to certainly expose them to whatever might be out there. I would say that, look, it's impractical at times to, unless you're sick, unless you have symptoms, it's different, right? If we're talking about true isolation because you're symptomatic, but it's impractical to really think about a family where 4 or 5 people are living together to be away from each other in the same household. But what we certainly don't want to do is then go visit those 5 people to another 5 people, even if they're your family. There's nothing magical about the fact that you have the same last name, that all of a sudden you go to another family and now you have, they're your cousins or they're your friends, and now you go over there, and that 5 now becomes 10 people, and where you were isolated from each other or separated from each other, now you're together. You have now just introduced whatever potential into that other household, or vice versa into your own household. So this is where when Sharif was talking about FaceTime, he was talking about Zoom, what we're doing right now. He's talking about telephone. He's talking about all those other ways, text messages, etc., or social media. This is what we're talking about. This is not the time for us to be together physically. And that's hard for us as Desis and Muslims, because we want to be together. We want to hug each other. We want to be together. We want to be somehow connected. This is the time we're saying, look, be emotionally together, spiritually together, but be physically apart.
Makes sense, right. A question about PPE. do we have plans to proactively ramp up PPE? I think it's private.
Personal protection equipment.
I knew that. It's just going to take me a second. And is Harris County in Texas currently looking to attain PPE through volunteer groups? And if that's the case, then how do we get people to help and volunteer in that capacity?
Yeah, you're the expert at this.
Well, yeah, why don't you want to start with the PPE question, and then I'll talk a little bit more about Harris County more specifically, and then give some tools that might help.
Yeah. So I'll just give it in general from the PPE standpoint. At the state level, the governor receives information from all the RACs, all the different emergency regional directors that are out there, which Amir is one of, and they look at what their needs are. They signal to FEMA what those needs are. FEMA sends a lot of that equipment over to the state, and then the state allocates it based on what the immediate need is. That's as much as possible. Here we're talking about touching faces, and I'm doing it myself. Got to think about not doing it. But the point is that we're trying to allocate it as much as we can. Now, I can tell you that industry, the petrochemical industry, other large manufacturers I know have been donating to a lot of the hospital systems. Memorial Hermann received quite a few from a couple of the industries out there. Methodist has. So I know that the hospital systems are eagerly accepting also donations from different entities that are out there. What we're doing at the state level, you know, the biggest users of personal protection equipment are healthcare workers. So things that are not necessarily needed to be done to minimize its use is something that the governor has asked us not to do, such as elective procedures and elective surgeries, which has created a tremendous amount of concern amongst healthcare providers and patients who want to have their surgeries done. The problem is that those surgeries, even though they may sound like they're urgent, every surgery is urgent, otherwise it wouldn't be done. But those that can wait for a period of time, we're asking folks to wait to have those surgeries done, because every single one of those surgeries utilizes a certain amount of that equipment. And then it becomes even more profound if that's a kind of surgery, for example, that the patient has to recover in an intensive care unit afterwards, because that takes up a very valuable ICU bed that we're desperately going to need as we have that surge later on. So the governor signed an executive order about a week and a half ago, stopping all elective surgeries. The medical board, as well as the dental board and HHSC that looks at facilities, has been empowered to govern when and where these things can be done and actually sanction those who violate those orders. But it's all centered around making sure that we have enough PPEs for when we have that surge, whether it's a couple weeks from now, a month later, whenever that might be, so that we can have the appropriate amount of equipment that healthcare workers need in order to be able to take care of the large number of patients who are going to need it in a month from now, or maybe less than that. Amir?
Yeah, no, I think, I mean, spot on. That's what I love about being on with Sharif, because he answers all the questions that I don't really have to. I mean, he gives the context right perfectly. And what I would just add is that here locally, yeah, there absolutely, we've got an incredible amount of goodwill from our community at large that's really said, hey, how do we donate? How do we do things? There are, if folks are interested in volunteering, especially if they've got health backgrounds, we do operate the Medical Reserve Corps for the community. And I can give the email address, but I think more importantly, the way to do it is actually our connection for all of the resources, whether you want to donate something or whether you want to volunteer your time, is through readyharris.org. That's READY, Ready, Harris, HARRIS.org. And if you can go to readyharris.org or go to Harris County Public Health website, you will find a tremendous amount of resources. That is the way centrally that we're providing information at the county, and obviously connected with the city and connected with the region, that we're providing a tremendous amount of resources there. And if you want to donate, you can go there, and there's a spot there, also a link for you to be able to donate various things. Now, obviously, everything counts, but you know, it really, what we're looking for, those real, the opportunity for really, vetted, if you will, N95 masks, or those really hard to get PPE that we've been talking about. But also it may be that we need your time. If you're a physician, or if you're a nurse practitioner, or if you're an epidemiologist, hint, hint, you're an epidemiologist, this is the time we really want you to be a part of our real efforts. And obviously those efforts will continue to expand over time, but we just need to make sure that we have everybody, together. And certainly that readyharris.org is a great website to be able to get to.
Great. And we're consolidating some of the questions, but some of them have to do with the current wave of cases. What is the strategy to prevent another wave or multiple waves? And how are you going to prevent the spread after this first wave is completed? Does that mean that we'll have frequent isolation and quarantines as our primary solution until a vaccine is produced?
Yeah, no, that's it. Nabila, that's a great question. So, from the public health standpoint, this is what's been really challenging, right? We said it was not a matter of if or when, it was a matter of now. And initially, when you saw in our community, it was really about the fact that if you had been in contact with somebody with a confirmed case of COVID-19 or had traveled internationally, that you would be those are the individuals. And remember, the first set that we had throughout both Fort Bend County, Harris County, et cetera, was really centered around a trip of individuals who had gone to Egypt on a River Nile cruise and had come back, and there was a cohort that was in our community. That's how it first started. But then a couple of weeks ago, if you remember, that we had the first case in Montgomery County, which was we could not figure out where this individual had gotten. And that individual also had gone throughout Harris County and other parts of our region. And so when they made that announcement in Montgomery County at 10 o'clock, within a couple of hours, we then, because that was one of our triggers, we immediately went to closing the rodeo and moving into the next phase, which was now we were worried about this was initial community spread and we were going to have additional community spread. And now we know we have quite a bit of community spread, and you could even go into potentially saying widespread community spread, because now a good portion of our cases are folks that we cannot identify who they were in contact with. These were not individuals who were traveling to a high endemic area, not just overseas, but obviously in Seattle or New York City, even here domestically. And so now what we're saying is, look, this is really a matter of our epidemiologists have moved from initially one person or 5 people and really locking down who the individuals were that they were in contact with and doing everything we can to do a ring around them and try to prevent, to now a point where we're moving more to, it's not containment of those individuals, but it's really doing our best to shift so we can protect people that are most at risk. And Sharif mentioned this, obviously our seniors above the age of 65, those with chronic health conditions, diabetes, high blood pressure, heart disease, lung disease, as well as pregnant women, as well as those with weakened immune systems. These are the individuals we want to really protect. But we're also absolutely concerned about those congregate settings, nursing homes, long-term care facilities, jails, and where we have, even individuals that are coming together, seniors, et cetera. We are very concerned about that. And so our efforts are now shifting not just to the individual who we're saying, look, if you're sick, stay home. If you're sick, stay away from others. We're actually focusing now on that population health. How do we really protect around where, for example, in the Woodlands right now, you have a nursing home where you have individuals who have been diagnosed positive. There's also some stuff going on in Lubbock and other parts of the state. So we're saying now we're focusing on those high risk groups as well.
If you look back to several weeks ago as to some of the things that we did that really had an impact, canceling of the rodeo, and remember that the rodeo had started, and even with that, there were some positives around some of the events around the rodeo. So you can imagine, had that continued on, the acceleration of the spread would have been, much, much more. South by Southwest in Austin. These are all things that back then it looked like it was overkill. But again, if you're overreacting today, it means that you're probably just about right, because you're trying to, prevent things that are going to happen 3 weeks later or 4 weeks later. So those are things that we were able to do, that the state was able to do, that the city was able to do, that helped mitigate where we are right now. Otherwise, I really strongly feel that Texas would be in far worse shape than we would have been otherwise. Right now, it's making sure that we prevent other clusters from coming in. I mean, as you saw what we did with Louisiana in the last couple of days, asking folks to be quarantined if they're traveling from Louisiana back into Texas. The strong shelter in place, I think we're becoming a little bit more on the enforcement side of it, at least as much as we can. Hospitals right now have instituted no visitor policies where Only the patient can go in with certain exceptions, just depending on the circumstance. But even those who go in, including myself, if you're in a hospital, everybody wears a mask. So everybody's trying to take it up a level just to really help mitigate that spread as much as we can. What we're really trying to do, just so that everybody understands, is spread the time period over where a number of folks are going to be infected so that we don't overwhelm our healthcare system. Because if we reach that capacity or exceed our capacity to where we can actually treat enough people, that's going to actually create even more harm. If we try to maintain that to where it's below our maximum capacity, then we can actually help take care of a lot of those folks, and hopefully, more people will survive that way. But just so that everybody who's listening can also understand what we're dealing with, if you think about, the settlers coming into the United States, when they first came in here, a lot of Native Americans died just because of the diseases that those folks brought to the country that nobody had ever been exposed to before. So what we're dealing with is a very new virus that nobody has ever been exposed to. And that's why the effects of it are so pronounced. As we have these other episodes happen later on, or other, surge events, it's going to be a lot less than we have right now. Hopefully by the end of the year, we'll start having treatments, a vaccine, to where we can actually, mitigate this. But, Amir, I'm sure you'll be able to let them know also that this virus is going to be with us forever. It's going to be there forever, but our ability to deal with it and manage it with the vaccine, with most of us having been infected beforehand and having developed antibodies to it, is going to help attenuate it. The unique circumstance that we're in right now is that we're all de novo exposed folks to a new virus.
So to that,
sorry,
go ahead, Amir.
No, I was just going to say, I think Sharif is really absolutely right, is that, we're doing everything we can to flatten that curve. And I started using this sort of metaphor today, which is that, we oftentimes make mountains out of molehills. This is where we're actually trying to do the opposite. We're trying to take a mountain and we're trying to make it a molehill. We're actually trying to do the opposite. We're trying to say, let's not have a surge that's going to hit our healthcare system right away, all at once, because it's going to overwhelm the system. And when you have overwhelmed systems, that's when you don't have hospital beds. That's when you don't have critical care beds. That's when you don't have ventilators. That's when you don't have the resources. And that's when you start to have really bad complications. And so let's make it a molehill. Let's spread it out. Now, antithetically, what the problem or challenge could be is that we spread it out. We actually might have more of this social disruption, which is what this is for us, over a longer period of time. But at least we know then our healthcare system can manage it. And that's the biggest challenge that we've got right now, is to continue to work in that direction.
Right. And Sharif was talking a little bit about vaccines, and we're getting a lot of questions about that. Are there any promising developments in terms of vaccines or cures? And then a follow-up to that is, have there been any advances with using the plasma of people who have recovered from the virus or tested positive to heal those who are having symptoms?
I'll answer the last question first. Methodist Hospital in the last couple of days has started using plasma from coronavirus positive patients who have recovered. The idea is that they have antibodies, and that those antibodies could potentially theoretically help patients who are infected to fight the virus. It's kind of like doing a vaccine, but in a very roundabout way. A vaccine will expose you to the virus and trigger your body to develop those antibodies. What you're trying to do is take antibodies and give it to somebody and hopefully have that fight the virus directly. It's being tried. Methodist, like I said, is doing it, and a couple of other places are doing it. We'll see what the results of those are. I can tell you that a lot of drug companies are feverishly testing different types of antiviral medications or other medications, like I'm sure everybody's heard of the Paquinil Zithromax. The FDA approved it just recently to allow it to be used on patients who are positive. There's still not a lot of data out there as to whether it works or not, but it's being looked at. But in Seattle, about a week and a half ago, they tested the first couple of patients with the vaccine, still in phase 1 trials, just to make sure that it's safe. So there's a lot of efforts being made out there to not only develop drugs that potentially can help attack the virus, but also to look at a vaccine. And I know multiple different vaccines are being utilized or being tested. Hopefully by the end of this year, or at least by the beginning of next year, there will be something there that can be promised. But there's a lot of effort that's being put into it.
Okay.
Yeah, no, I agree. Yeah, I was just going to say, I completely agree with what Sharif just said. And the only other thing I would add is that, look, our best protection right now, our best defense, what we have to offer is not a vaccine right now. It's not an antiviral. It's not anything else except for our ability to distance ourselves from each other and to protect ourselves and protect those who we love. And hopefully we love not just ourselves and our families, we also love our community. And so we have to do that. And I really want to emphasize that, especially in many of our communities that are oftentimes, whether it's a Muslim community, a Jewish community, whether it's an African American community, whether it's a Hispanic community. I really want to emphasize that all of us are in this together. We have to do everything together. And so if there are practices that are in our own communities that are somehow being, let's say, look, as Sharif had mentioned about the masjids and masallas and folks are not, and you mentioned about Ramadan, if folks are not coming together in a congregate setting at a mosque, but they're going home and doing the exact same thing, we have just defeated the purpose. And in fact, we have put our own community more at risk. And that is not something we want to see. And that is something we have to really make sure that everybody recognizes that we are all in this together. And we are going to be successful together, but we're also going to potentially fail together if we don't do this together.
Right. Risks for pregnant women, newborns. Are there any special risks that pregnant women should be aware of?
Well, we know that there was a recent transmission to a newborn, I think, recently. So a coronavirus positive mother can transmit the virus to the unborn infant. So there is a risk there. Women who are pregnant their immune system may be a little bit more compromised, so they may be more susceptible to the virus. There's also concerns that if they do get infected, the medications to treat it can also affect the baby, affect the fetus. So a lot of those risks from the standpoint of getting the virus and then having to be treated for the virus certainly puts the mom at risk.
The mom and the baby. And so I think Sharif is absolutely right that this is why we say, look, at the end of the day, this is right now the most studied virus in the globe. Right now, this is the virus that's being studied. We're learning so much. There's so many viruses that are out there, and you slowly evolve information. You learn over time, over years. We don't have time. Time is our enemy right now. The virus is our enemy, and so is time. And so there is so much that we're learning, and that's why you're getting so much information on a daily basis, on a weekly basis, on a monthly basis. You're getting so much. It's rapidly evolving. It's harder, even for us as scientists and practitioners, for us to keep up with it. But I'll tell you that this is why we want to say those most at risk. We want to really make sure that people protect themselves, that we protect those that are most at risk. It doesn't mean that the children, we have this misnomer that kids aren't going to have complications, that the 20, 30, 40-year-olds aren't going to have complications. That's not accurate. The physician in Wuhan who raised the flag, he was 34, 35 years old. He died. I mean, this is something that we need to remind ourselves that, look, all of us are at risk. But what we're saying is those who are most at risk for those complications start to be those seniors, start to be those with underlying health conditions, pregnant women for the reasons Sharif just mentioned, and also those with compromised immune systems. So we have to do everything we can, and I can't emphasize this enough, and I'm sorry to be on a soapbox, but we have to do everything we can to protect ourselves, protect our communities. It is incumbent on all of us to do that.
Yeah, I want to just echo something that Omer said. The worst enemy that you can have is the one that you can't see. And even worse than that is the one that you can't feel. And this virus is unique in that the vast majority of folks don't get any symptoms. Mm-hmm. And you're going to be able to transmit that virus when you don't have symptoms. And it's more virulent. That's just a recipe for disaster, because it's at least 10 times more potent than the flu. You think it's much more than that, but at least 10 times more potent than the flu. It's transmitted much more easily than the flu, and you can transmit it when you have no symptoms whatsoever. And in a scenario where we don't have any immunity to it because we've never been exposed to it before, that's why we are risking devastating our economy to prevent this from happening. And I just want to make sure that people understand why we're actually looking at it that way. If you can imagine, we're a country of about 350 million, if not more. If you imagine that at some point, at least 50% of us are going to get infected, okay? And if you are assuming on the low end, 2% are going to have a mortality rate, that's where the 2 to 4 million death number comes in. And that's why everybody's putting a tremendous amount of effort to do what we're doing right now. So from the perspective of folks who are going through a lot of financial difficulty because of what we're doing, it's painful, and we've got to make sure that we help those who are in need right now. But that is why we are taking it so seriously, because the ramifications of not doing anything are immense.
Right. Well said.
Does azithromycin work to relieve the symptoms? Azithromycin.
So I just mentioned this briefly earlier when I said Zithromax, but whoever's saying azithromycin is doing the proper thing, but actually using the generic name. So there's a couple of malaria drugs, and the antibiotic azithromycin, which a lot of people take for the common bacterial cold. It's not a viral medication. It's not an antiviral medication. It's actually an antibacterial. There's been anecdotal evidence that taking those two medications can help speed the recovery of the virus. Again, I'm being very careful what I'm saying. It's not a prevention. In other words, it's not going to prevent you from getting the virus. That's very clear. It's not a cure to the virus, but the anecdotal evidence there is that it helps speed the duration and the symptoms of somebody having the virus. Now, it's anecdotal. There's a lot of really great institutions out there that are testing it now on large number of folks. The anecdotal evidence that we have from Italy and from some of the other countries were a much smaller number of patients. But the fact that the FDA has approved it for use right now is going to allow some of the centers to look at a larger number of patients and to be able to look at it prospectively to actually see, does it really help or not? But I'll add one really quick thing. So the Texas Board of Pharmacy, about a week ago, has actually limited the use of Zithromax and Paquinil to diagnoses that are clear for their use. And this was before the FDA approved all this other stuff. And the reason being is that folks are getting prescriptions of these medications, even though they may not have had any reason to have it. And the concern was it was starting to really deplete the supplies of the medications for those who really did need it. So there are folks out there who are immune compromised who need to be on those medications, and they weren't able to get it because others were starting to hoard it just from the standpoint of having it available if they were to get the virus. So we just got to be careful of making sure that we're using it in a thoughtful way. It really needs to be prescribed by a doctor who knows you. And as the Texas Board president, I'm saying that from the standpoint of a physician needs to have examined the patient, even if it may be through telemedicine, and understood what the patient's symptoms are before properly prescribing it. Otherwise, it's an inappropriate prescription to a patient, and somebody like me is potentially going to sanction a physician for doing so improperly. So get it from the proper source and for the proper reason.
Yeah, and Sharif, just one quick thing is on the telemedicine, telehealth piece is that we are also actively working with the dental board, and anything you can help with that as well, because there has been some question about teledentistry and not being allowed, and there are some I've had multiple dentists who have contacted. Our dental chief has had this concern, and so that is something that we do need, because on the one hand we're telling all of our providers look for emergency care, but it's really hard to do emergency care when you're not able to obviously in person see them. And so that's where teledentistry comes in, or telemedicine, telehealth. And so just something to carry a message. If I can ask your favor as the medical board president, yes, I think that would be really helpful for us as well. So
Omer,
I just wanted to make sure you were aware of that.
Yeah, you bring up a really good point. And guys, for those of you who are wondering, the way this works is that with the state of emergency, this triggers the regulatory agencies, like the one I had, to ask the governor for certain waivers around certain specific rules. So for telemedicine, for example, our typical rule is that you have to be able to have more than just the ability to talk to a person on the phone and get their symptoms in order to be treated. We waived a lot of those requirements to where you can just use a telephone conversation in order to be actually for a physician to be able to manage a patient. Also at the federal level, CMS, Medicare, and others have also waived their rules around HIPAA requirements so that a physician can actually use FaceTime, other means that normally we would not even allow because they're not HIPAA compliant. HIPAA is the law that basically says I have to protect your information, I have to protect you as a patient and not release that information. So you have to do things in a very, very controlled environment. well, these are very different, unique times, so we've kind of loosened those rules. But as we as a medical board have gotten a waiver from the governor in order to be able to do so for physicians, the dental board, which is a different agency, needs to be able to do the same thing to the governor's office and ask for those waivers. So to Amir's point, I will pass that message along to the governor's office and see if we can make that happen quickly.
Great, thank
you. Thank you, Sharif. And Nabila, real quick before you either close out or your next question, I just wanted to make mention that we have created a tool for in Harris County that is the sort of screening tool. It was the first of its kind in Texas, online screening tool where you can go to, again, readyharris.org or Harris County Public Health, and that online screening tool goes through a number of questions and gives you whether it's reassurance that, hey, you should not at this point, especially in line of the fact that we don't have unlimited testing right now, that you should be reassured or you should be isolated at home while you're, continue to sort of watch symptoms. Or if you do have symptoms, it gives you a unique identifier that then gets you into one of our partner agencies for a call center, where then we have professionals who then triage you through to get to one of our test sites. We have 2 additional sites. Those are for the 2 county sites, 2 additional test sites that the city have. They just launched their second site yesterday. We know that Fort Bend County now has testing coming in a couple of sites, and obviously there are a lot of other testing sites throughout the community, including nonprofits, for-profits. You can go at least contact your physician or healthcare provider. If you don't have one, contact Harris Health's Ask a Nurse hotline to really figure out if you have symptoms or concerns, or one of the 2 health departments, Harris County, City of Houston, or obviously Fort Bend County, Montgomery. I mean, there's so many ways you can go about doing this, but I do want to make that comment that if your provider makes contact, or you make contact and say, look, I feel like I need to be tested, and that provider says, yes, I agree, there are mechanisms for that provider to be able to get you tested, whether through Quest or LabCorp or other private commercial labs, or even if we work through the private sector. I do want to emphasize that testing or a test is not the focus. It should be an evaluation. And the evaluation starts with whether or not you should be even tested in the first place. And that's something that I think we have lost sight of in this country, that we're so focused on a test, we've forgotten a part of the evaluation process, which then includes, and a significant step could be, a test, but oftentimes it may not be. And we have to make sure that people recognize that evaluation starts at home, evaluation starts with online tools, evaluation starts with contacting your healthcare provider, evaluation starts with having conversations with those who are health professionals, but it does not always mean that you should be tested. In fact, there are false negatives if you get tested and you have no symptoms, and there's false reassurance that I got tested Friday. My test result came back Monday. I had no symptoms on Friday. On Monday, I'm like, hey, I got a negative test from Friday, but that's when your symptoms start. And guess what? Now you're actually somebody who, if you did get tested with symptoms that have started, you might come back positive, and you may just assume that it's now something else, but it really is COVID-19. Sharif, I just wanted to add that in as well.
Yeah.
Well said, Amir.
All right, I think this is the last question, and thank you everyone for being so patient, but I think it's important we listen to what's on people's mind right now. And so this is the last one. There have been complaints that healthcare providers are not being provided adequate PPE. So what information can you give us to relieve some of the worries of our frontline workers? Are there any laws in place? Is there anything that these frontline workers can do in light of this shortage of PPE?
So I'll tackle this first, and Mary, you could follow. So yes, you're right. There's not enough PPE out there. We are, as I mentioned earlier about the elective surgeries, we are trying to do things to minimize the use of PPEs so that we're saving it, not for elective stuff, but for things that are absolutely needed. So I've heard a lot of patients complain that they can't go and visit the physician's office and do something that is somewhat elective, but everybody's got to understand that there's a greater reason for that, is that we want to be able to preserve those for where we truly, truly need it. I know the president has signed the executive order a couple of days ago to allow for the manufacturing and additional manufacturing of of additional PPE gear. Could that have been done earlier? Absolutely. But we're past the woulda, coulda, shoulda. We're at a point right now where we're trying to conserve as much as we possibly can. We've got a lot of, mashallah, really creative folks. A lot of them are Muslims, actually, who are coming up with ways to actually manage this process as best as they can. You know, I'm hoping that we're going to start gearing up. And, you know, I've heard that several manufacturers, 3M and others, are starting to ramp up their production as much as possible. But Amir, I'm sure you'll agree with me, there's a lot of lessons learned here. And again, you don't have a pandemic except for once every multi-generations. But I think recently we all fell into this lull of why should I be spending money and resources into something that probably will never happen? Well, it's not that it's never going to happen. It's going to happen. It's a matter of when. And, you know, the last big pandemic may have been back in, well, I'm not going to even mention H1N1, but going back to 1919, something that was so easily spread. H1N1, the advantage of H1N1 is that people were symptomatic when they were able to shed the virus. So people knew when they should isolate themselves. As I mentioned earlier, this is a little bit more unique in that you can actually transmit it without having any symptoms. So going back to what Amir said at the very beginning, spending on public health is so important, so critical. And, you know, again, this is not a woulda, coulda, shoulda. We're doing what we can right now, but I think there's going to be a very different conscious effort for the federal government to spend the resources that are necessary to make sure that we are adequately prepared on a constant basis for something that we don't necessarily visibly see. You can't wait until you have a problem to prepare for this. You got to already be prepared ahead of time.
Yeah, and I would just add to that. Thanks, Sharif. I completely agree with everything you said. And when I testified in Congress last year, that's exactly what I said. We have and I maybe I was one of the few outside of social media in Congress that have ever done this, but I said we have a hashtag invisibility crisis. That because we are so invisible, there's really this lack of understanding what we do. And I said to combat that, we have to have the 3 V's, which is raise the visibility. When you raise visibility of something, you have value that entities and folks and individuals and policymakers, as well as the public, they value something. When they value something, then they validate it. And they validate it with pro-health policies or pro-health funding. And that is something that I think it's an indictment in our country that we have not done what we need to do. And Sharif is one of those frontline healthcare workers. He's incredibly, you know, he's not just obviously all the medical board stuff that he does, but the incredible amount of work that he does along with colleagues in the healthcare system. It is so wrong that our healthcare system has not had the protections that it needs to in order to be able to take care of the very patients and that are coming in. And we have said, and this is really important, that if our healthcare system, our healthcare workers go down, if our first responders go down, we're cooked. We're cooked. And that is so important for us to be able to really have serious discussions about all those other aspects. But that's woulda, coulda, shoulda have, and down the road. Right now, we're in the middle of it. And we're doing everything we can to preserve PPE, personal protective equipment. We're doing everything we can for the elective surgeries and elective procedures so that they're not using up the precious PPE. We're doing everything we can to encourage donations and being able to get additional supply chain so we can actually get PPE. And we're doing everything we can to ramp up the PPE production. All that together, inshallah, soon, we will not have that issue as much as it is now. But right now, it's a very real issue. And it's not just about the PPE, it's about ventilators, it's about other kinds of real challenging and critical pieces to the puzzle. And so I think all of this goes to, we have a role to play as a community to flatten the curve, do everything we can to socially distance ourselves, because ultimately we have to protect that healthcare system. Otherwise, we are really going to have a significant issue, as unfortunately we're seeing in other parts of the country and the world.
So I said that was the last question, but then we started getting a bunch and they kind of correlate. So this really is the last question, I promise. When do we expect to peak here in Houston? When is the peak expected?
Yeah, so I think Sharif covered it earlier, if I remember, but I will say that we are, you know, there are a lot of models and estimates out there, and including University of Texas School of Public Health and even UT Austin and other models that are out there. And really the thought is that the peak is late April into May, that it's going to be through June. Obviously, if you think about things like school, we're probably likely past the time where school's going to come back in session for our kids, if that's a question that's coming up. But honestly, these are models, and really it's about us. It's about the efforts that we stay off the streets and we do everything we can to be at home, and we really try to do as much business as we can, as much work as we can away from each other, emotionally connected, but physically apart, physically distanced. That is so critical to this. It is up to us when that peak, first of all, hopefully that peak doesn't happen, but it's up to us when all this happens and how quickly we get past that. And so I think it's an unknown equation, but it really has a lot to do with really what we together empower ourselves to really assure that we are going to protect ourselves, our families, and ultimately our community.
What I would encourage everybody to do is pray for us. The next couple of weeks are going to be pretty rough, not necessarily here in Texas, but around the country. I pray that it won't be that bad over here at the end of the month. We're doing what we can right now to try to help mitigate that. But we're probably going to see things that we never expected to see in our lifetimes in the next 2 to 3 weeks. Omer, we're already starting to see the ICUs fill up in Houston. We're already planning for that whole surge capacity and all that. Just please do your part. Obviously a lot of us feel like it's out of our hand and it's out of, we can't do anything. If you feel kind of helpless, but actually Omer just touched on a lot of the things that we can do, which is keep your social distance, try to avoid large space, congregating and so forth. Be close to your family, the ones that you're already with at home, not everybody else. That's where you can FaceTime and do all the other stuff. And Ramadan is coming up, and I think that is really going to be a time for reflection and for prayer. Just again, if I can just give one message to everybody, those healthcare workers that are out there, they're putting their life on the line on a daily basis, not knowing if they're going to be exposed or get into a circumstance where they're going to get sick themselves. They're scared. We all put up that wall of that adrenaline rush, but I know that my wife and my kids are always nervous, when Omer and myself are at the hospital on a daily basis, or any of those countless other healthcare workers that are there. So we always appreciate your prayer in our community and so forth, and we're going to really need a lot of it in the next month.
Great. Well, we want to thank you so much for being out there on the front line, doing everything that it is you're doing. All of our healthcare workers, we really do appreciate it. And not just our healthcare workers, but the people that are in the grocery stores, the people that are doing the deliveries, the people that are taking care of the hospital and making sure it's clean and an inviting place for everyone to come in. Everyone that's doing it, we do appreciate it. We thank you. I think we're sharing something, the Ready Harris site, readyharris.org. Please do visit it for more information. And also just a last reminder to please complete your census. I know it's not what's on everybody's mind right now. It's Corona all the time, but it's so important because we want to make sure that we get the resources that our community needs. And that happens when we can show we have the numbers. So the way we do that is we complete the census, and you can complete the census by visiting my2020census.gov. Again, less than 10 minutes. So again, thank you so much to Sharif. Thank you to Omer. We appreciate your time for taking all of these questions. And we'll stay in touch. Maybe we can do another one if this keeps going on. We'll see what the community is asking. But again, everyone take care, stay safe, and inshallah we'll meet again and we will get through this. So any last words, Sharif?
No, thank you. Thank you for doing this. We're all here for each other. What Nabila said about the census is actually critical, because the healthcare dollars that come from the federal government to us where we need it is all based on what the government thinks or believes is the population in certain areas. So if we're not reflecting how many of us there are, we're not going to get the appropriate amount of healthcare dollars that we need, as well as other things that are important to us. So it's really, really important that we do this. It's once every 10 years. If we don't get it right now, we're not going to get the resources that we need for the next 10 years. So you got to do it. It's important.
All right. Thank you, everyone. Take care. Stay safe, and we'll talk to you soon. All right. Bye-bye.